Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of migraine. Migraine can be treated by mild, moderate, and severe migraine. Mild migraine. In the mild, there is less than one episode of migraine is present per month, or if each episode is less than 8 hours per episode, then it is mild migraine. In mild migraine, we give simple analgesics can be given with NSAIDs, with or without antiemetics depending upon the symptoms of the patient. Then we have moderate migraine. In moderate migraine, there is more than one episode of migraine is present per month. That is equal to 24 hours of each episode is seen in moderate migraine. In moderate migraine, NSAIDs are given in combinations, or you can start with sumatriptan, or you can give ergot alkaloids can be given plus or minus antiemetics. Then we have severe migraine. In severe migraine, there are more than 2 to 3 episodes are present per month, and each episode is lasting for 48 hours per episode. That is severe migraine, and this is also associated with other symptoms like vertigo, vomiting, and other symptoms. In such cases, we give ergot alkaloids can be given with sumatriptan or rizatriptan with antiemetics. Then prophylaxis of migraine. In the prophylaxis of migraine, the drug of choice is propranolol can be given along with the other beta blockers. We can also give anti-epileptics like topiramate can be given, or sodium valproate can be given. So these propranolol, topiramate and sodium valproate are the drug of choice. Amitriptyline can be given, or other anti sorry tricyclic antidepressants can be given. So flunarizine or other calcium channel blockers can be given. Then methotrexate can be given, or cyproheptadine is used for prophylaxis. Clonidine can be used for prophylaxis of migraine. Onabotulinum A is used can be used for prophylaxis of migraine. Dihydroergotamine, though it is rarely used for prophylaxis of migraine. So, if you have to give the ergotamine or NSAIDs, it is better to add caffeine is given along with ergotamine or NSAIDs, because caffeine increases the absorption of these drugs. Then there is an opioid which is butorphanol. Butorphanol is used as the drug of choice for acute migraine, which is associated with coronary artery disease. Then both ergot alkaloids and triptans are actually contraindicated in ischemic heart disease. There are newer drugs which are discovered for migraine. These newer drugs are, we have olkigapant, olkigapant and telkagapant. So these two, olkigapant and telkagapant, these are the new classes of drug which inhibits calcitonin gene-related peptide. They inhibit calcitonin gene-related peptide, and thus they are used in classical migraine with aura. The next new drug is lasmiditan. Lasmiditan is a 5-HT1F agonist, and this 5-HT1F agonist is used in acute migraine attacks like triptans. Like triptans, we can use this lasmiditan, which is a 5-HT1F agonist. Recently, even transcranial magnetic stimulation has been tried for the patients.
thank you and thank you for watching.